Hi, I'm Tom George. I'm System Medical Director for Neonatology at Children's Minnesota. I've been bouncing around the Big Ten. I went to Purdue for my undergrad and Indiana for medical school, and then the University of Iowa for residency and fellowship, and then I was at the University of Minnesota for the last decade. I've had the opportunity to work with Children's Minnesota physicians over the last decade in my previous role, and when this position opened up, I was excited at the possibility of working even closer with these physicians and practices at Children's Minnesota, both in St. Paul and Minneapolis, that I have known to be dedicated to babies, children, and their families, dedicated to fantastic outcomes, dedicated to terrific clinical programs. And when this opportunity arose for me to maybe play a small role in the building of one unified neonatology program, that really struck me and really excited me. Children's Minnesota has had two fantastic NICUs in St. Paul and Minneapolis over the last several decades. And this role was created to see if there's a way to bring the two units together as one system NICU, looking at things from our clinical standards of practice to looking at outcomes and sharing best practices, and really building upon an excellent history that both have had sort of individually, and seeing if there's a way to partner those practices to have something that's unique and individual, but at the same time has the best of both. So my mom always knew I was going to be a pediatrician, and so very early on when folks would ask me that question, starting at about age 6, 7, I said, I'm going to be a pediatrician. And they'd ask why, and I'd say because my mom told me to. And that's sort of what came to pass, and I have absolutely loved every moment of it. Being a doctor and a neonatologist has taught me several lessons. One is that none of us works as an individual when we care for babies and their family. It really is that there are many, many team members involved in the care of a baby and their family that leads to optimizing the outcome for those babies. And it's that team approach that really leads to the best outcomes for babies and their families. Children's Minnesota has had a long history of fantastic care for babies and their families in the neonatal programs at St. Paul and Minneapolis. And what I'd like folks to know is that what we're going to do, and we're going to strive to do, working with partners across Children's Minnesota, is to take this phenomenal foundation and build a unified program that allows us to build into the program efficiency, that allows us to capture best practices, to share those best practices in an open manner, and to hopefully lead to even better outcomes and regional and national recognition around the phenomenal people and care that we provide at Children's Minnesota. Outside of work, my wife and I both play soccer on an intramural league, and that's always enjoyable, where the goal every Sunday night is to not get hurt. But we continue to have fun with that.